I made a commitment. I get up at 5 in the morning and I got 2.5 hours dedicated to me. That I'm making progress in all the most important categories of my life. Sitting at this desk and working by 8. I mean, man, talk about something that can move the needle. I'm excited about sharing that with dentists.
All dentists know the common career paths, but how do you know which path is right for you, and are there other options out there?
On this podcast, we will be chatting with industry experts. We want to bring you the knowledge and resources you need to take your career to the next level and break down those industry secrets interview by interview.
We are here to ignite a revolution in the dental landscape
and help you, the dentist, build the career you have always wanted.
I'm Dr. Cassidy Reeder.
I'm Carter Frank.
And welcome to the Revolution Dentistry Podcast.
I'm Carter Frank, here with Dr. Cassidy Reeder. This is the Revolution Dentistry Podcast, where we help you with strategies to build lasting success for yourself and for your family. Today we have a very special guest, Dr. Jim Arnold. Dr. Jim Arnold is a multi-award-winning dentist, visionary entrepreneur, and top-performing executive with over 25 years of experience revolutionizing the dental industry. Dr. Arnold is renowned for his ability to seamlessly blend clinical excellence with business expertise, having built and led multiple high-achieving dental practices, driven operational growth, and advanced the profession through education and innovation. As a clinical instructor, consultant, and advisor, Dr. Arnold has played a pivotal role in the development of dental organizations, practice management strategies, and private equity partnerships. He's been instrumental in helping launch and grow 4 DSOs, contributing to more than $100 million in acquisitions and $20 million in EBITDA growth. Beyond his business acumen, Dr. Arnold's passion for elevating the dental community has led to achievements like winning the prestigious National Doctor's Choice Award, serving as a peer-review chairman for over 500 dentists, and even performing live full-mouth rehabilitations for audiences worldwide. In this conversation, we'll explore his journey, his current ventures, including luxury dental retreats, and his vision for the future of dentistry. Stay tuned for a masterclass in innovation, leadership, and clinical excellence. Welcome to the podcast, Dr. Jim. Super excited to have you.
Hey, it's great to be here. Thanks for inviting me, guys.
Of course. We, as you guys just heard, Dr. Jim Arnold has an incredible amount of experience and track record. You know, Dr. Jim, you've had a remarkable career over the past 25 years with achievements in clinical dentistry, business leadership, innovation. You know, can you start by sharing the key moments or decisions that shaped your journey?
Wow. That's a big question. There have been a lot of them, Man, thinking back to the beginning, I was an associate for a few years in a practice that was really underperforming, but had a lot of potential. And I think deciding to stick with that and kind of formulate a game plan for when I took over was a really, I think, pivotal decision. But beyond that, really finding great mentors was important. When I was a young dentist and didn't have a lot of experience, there were a lot of things that I wanted to learn, a lot of things that I wanted to accomplish. And so I went out there in the industry and found people doing the things that I wanted to do, and then utilized, kind of their skill sets, their, experience, their successes, their failures, and, really try to leverage all of that into sort of the vision for my future. And at the end of the day, I don't think there was ever one mentor who had like everything that I wanted, or not everything that any one person said really resonated, but I picked up bits and pieces from probably dozens of mentors early in my career that I think really helped shape my career moving forward.
I feel like you hit the nail on the head, Jim. It's that mentorship is so pivotal. And, Carter and I, we're younger. I started my dental career, not that long ago. And for me, what you just mentioned rings so true, that finding that mentorship is so important. For me, it's been more about having one or two people that have been lifting me up and have been putting a lot of time and energy into helping me. And for others, it could be like what you said, finding many, many people that you take bits and pieces from, that you can build your ideal future off of. And so I think that that's awesome. Thank you.
Well, and I'll say this, you can also take on too many. and I tend to be a man of extremes. And I told you I had a list of a couple dozen mentors, and I had specific things that I wanted to learn from each one of them based upon what I felt they were really, really good at.
Hmm.
And then I had a couple of what I'd call all-arounders who I thought did everything really well, and I wanted to emulate a lot of their success. But at the end of the day, you can learn all of that stuff, and it means absolutely nothing unless you go back and you actually implement it. And
Right.
for me, implementation is it can be really challenging. I mean, especially if you're like alone on an island in your practice. I think
Right.
sometimes we as dentists become micromanagers. We
Hmm.
think, well, we're the best, we're the smartest, we're the most talented, and we're just gonna like do it all ourselves. And I think honestly, that was one of the biggest mistakes I made as a young dentist, because I did feel that way in so many
Yeah.
ways.
Yeah.
And the reality is, it's really easy to become a jack of all trades, master of none. And so for me, probably the next real pivotal decision was to start delegating. Get
Right.
a couple of really good key people who I could really trust and I knew shared my vision for what we wanted to create, and then to start delegating to them. And the beautiful thing for me was once I saw them being successful, once I saw them helping drive the vision forward, oh my gosh, that expanded the entire operation, and that I was in a position to add more really key team players. I mean,
Right.
we were fortunate. Look, we can't. None of us can do this alone. It does take a team, and if you don't surround yourself with really talented people who have a heart for service and a heart for teamwork and a great work ethic, then you're probably not going to accomplish very much, frankly. And my
Right.
people really elevated me, and that comes down to really finding the right people, giving them the tools necessary to be successful, putting them in positions to be successful, and then just watching them go. There comes a
Hmm.
time where you go from being an engineer just doing the dentistry to a time where you're managing a great team to hopefully a time where you become more of a visionary leader when you
Right.
have great people who kind of keep the trains running on time, so to speak, every day. I was really fortunate to get that point pretty quickly in my career.
Wow. Wow.
Awesome.
That's incredible. Thank you.
Yep. So, as a multi-award winning dentist and top performing executive, how did you learn to effectively balance clinical dentistry with the business side of practice ownership?
Well, that's a question that I think almost goes right back to the first question. I mean, finding dentists who had done that successfully was probably the first step for me, and trying to learn again from their successes and failures in that. Some of it was trial and error on my own part, and I mean, I'll be the first to admit that I made every possible mistake you can make. I mean, I went in with a really lengthy, what I thought was very solid game plan that I aggressively or assertively implemented. And some of those things were mistakes. And at the end of the day, I think that we've all got to be very self-aware. I think we've
Hmm.
all got to be, in a position to accept not necessarily constructive criticism, but constructive feedback. Whether it's from other people, whether it's from the results that we get that we're not super happy with. I think that being flexible and being willing to learn from our mistakes is a really critical aspect to that. Now, in terms of the balance, man, it's really never easy, but it does get easier as you build a really competent team. A team
Hmm.
that you really trust. And
Hmm.
again, going back to that, when I was able to start passing some things over to really good people, it made it a lot easier to get that balance right. Because boy, early on, I was out of balance, man. I mean, I was working 90 hours a week, whether it was
Oh my
clinically or on the
gosh.
business. And what happens then? You get out of balance with the rest of your life. And so, without a great team around you, the balance part, I think, is just about impossible.
I feel like one of the key moments or decisions in your life, if I'm hearing you correctly, is deciding um, to delegate that responsibility to the right people and to create a team that you can surround yourself with that you trust and that have the talent to take on those responsibilities properly. And it sounds like, you know, once you've done that, it was able to help you create that balance in your life that you were looking for and that we all need so that you don't have to work 90 hours a week if you don't want to.
Absolutely. And sometimes they don't necessarily have the talent, but they have the potential,
There you go.
and you've got to, I think, recognize that, you can train people with the right personality and the right work ethic to do anything. But early on, I hired a lot of people with just really impressive resumes. Like, oh my gosh, this is incredible. And, if they come in and they don't have the people skills, or they're not like committed to being good team members, if they're not like really committed to serving our patients, how good the resume looks means absolutely nothing. I mean, I
Hmm.
hired people outside of dentistry sometimes when I recognized somebody who just had the right personality, work ethic, and they came in and ended up being my best people, because
Yeah.
you can't train personality, you can't train work ethic, but if you got the right people, you can train them to do just about anything.
So, what would you say? Let's talk about a dentist, right, who just owns one practice or maybe two, right? Someone who, it has to wear a lot of hats, right? Because they're a business owner and they're a dentist. What would be one way or an example that you could give that dentist of trying to delegate a responsibility that might be pretty, big burden on one of their team members?
Well, I think a couple of things. One, you better have a very clear um, understanding of exactly how that particular system works
Mm-hmm.
and be able to articulate
Mm-hmm.
that to them clearly.
Okay.
But I think just as importantly is supporting them in terms of their continuing education and
Okay.
their support, maybe outside of what you can give them. Again, sometimes if you've got the skill set, all the answers, and you can articulate that clearly,
Mm-hmm.
then awesome, more power to you. If you have team members, people who work with you who have that. I mean, after several years, my team knew how the practice operated better than I did in a lot of ways. And they became the ones who trained the people who came in, and then they were able to delegate further. And those are the things that allowed us to grow, more rapidly. But there are just a lot of resources out there in the industry, and I think being very selective about who you go to for education, who you go to for kind of implementing new systems, I think is critically important.
Mm-hmm.
But yeah, I mean, when you think about it, if you're going to take time to train people, well, yeah, that's like another big thing that you
Right.
have to do. And if you can clearly envision being able to delegate to people who know what they're doing, then that investment in time, I think, is time very well spent. We had weekly meetings.
Mm-hmm.
I mean, every week we would set aside 2 hours just to work on whatever it is we had to work on. And
Right.
there were times where I led the whole meeting because I had very clear objectives, and there
Mm-hmm.
were times where different key team members took over certain parts of the meeting. And those were the best meetings we probably ever had. Those gave us a chance to really work on those things. And we had a meeting 15, 20 minutes every morning before we started the day. It's all about communication. And most offices, honestly, that I've seen, they just don't communicate. They think they're on the same page, and you spend a couple of hours watching, and they really aren't.
Right. And, I feel like that opportunity to give your team members like a front office staff or a lead dental assistant or, whoever, the opportunity to lead some of these discussions in biweekly huddles and weekly huddles, whatever, can help edify them and give them, that experience of leadership to, help them learn what it takes
No
to
doubt
lead a
about it.
team.
Yeah,
Yeah.
they've got to feel a certain level of ownership, and ownership doesn't have to mean they own equity in the company. It means that they have the autonomy to make some decisions
Hmm.
and to teach the people they work with to do things at a higher level.
Yeah. Go ahead, Carter.
Absolutely. So, as mentioned in the intro, you've played a critical role in launching and growing multiple very successful DSOs, contributing to significant financial success. What insights can you share about working with private equity and scaling dental organizations?
As you mentioned, I have done a lot in that space. I was very fortunate 10 years ago when I decided to partner with a DSO. The gentleman who started that, they're private equity guys who were really excellent. I mean, they're good people. They had a great vision. They were very ethical. They took good care of their companies, and that's why we're still friends to this day.
Hmm.
That having been said, I've seen a lot of situations, and probably the majority of them in the private equity world, that have not been beneficial to dentists.
Hmm.
Unfortunately, when the uh, when the private equity firm, DSO, dentist, dental office aren't properly aligned, when they're not rowing in the same direction, when they have interests that are in conflict, which unfortunately I see quite a bit, things don't tend to go as well for the dentists, and I think that that's happening more and more frequently these days. Now, again, my guys, I think they've done things right. I think they've learned a lot, but it's just I don't think that's been the norm. You know what? It's not easy to grow a company. It's not easy to scale success from 1 to 3 to 10 to 100 to 500.
Hmm.
One of the biggest issues that I see is with poor infrastructure development. And
Hmm.
I've seen very few DSOs or dental groups at large that have scaled their infrastructure at the same rate that they've scaled their acquisitions,
Interesting.
or they've made too many acquisitions too quickly, taken on too much debt, and then
Over
all of a sudden, if
leveraged.
there's a financial downturn like the pandemic, well, things don't go so well. They get out of the ratios start to look really bad, and so I mean, I'm saying all of that is sort of a precursor to where I'm at now, in terms of my philosophy when it comes to building a dental company.
Hmm.
I would much rather be in a situation where the dentists maintain not only autonomy, but control over the trajectory of the company. I
Hmm.
mean, since the dentists are the ones who are entrepreneurial and built businesses that have been successful, businesses that have provided great lifestyles for their families, for their teams,
Hmm.
great work environments, great care for patients. Nobody knows how to build, grow, maintain, scale that sort of a business better than dentists. And so, you know
Hmm.
what? The money to be made in that sort of an ecosystem should really be weighted towards the dentists,
Hmm.
not executives who come from
Hmm.
outside of the dental world. And so everything that I'm
Amen.
doing moving forward is really moving more in that direction. I mean, I'm excited personally about partnering with dentists who want a situation where they can not only come out with more money on the front end, but more passive income moving forward, more autonomy to practice the way they've always practiced, more autonomy to build great teams, more autonomy to grow and expand their empire. And because I have been so involved with buying and selling privately, corporately, and been involved in 60 or 70 different major transactions, I mean, like I've seen the good, the bad, and the ugly, and I'm super excited moving forward to provide the very best opportunity for every dentist that I know or has any interest in having some sort of a partnership with me. So it's an exciting time if you can't tell.
You know, you were speaking our language here, Dr. Jim. We're the Revolution Dentistry podcast for a reason,
Yeah, I like
right?
it.
We want to
Revolution.
spark a revolution in the industry so that dentists realize what opportunities exist in today's landscape for them, such as being the ones in control of the groups instead of private equity or corporate, right?
Yeah.
And what you're sharing is so inspiring. I really hope, and I have no doubt that this is going to translate to our listeners, as hope, right? As excitement.
Absolutely. Look, the landscape has changed significantly, and I think the pandemic, as horrible as it was in so many ways, and as bad as some of the outcomes have been for dentists over the last few years, it has, in my mind and my heart, created a total reset in terms of what's possible and
Hmm.
what should happen moving forward. And
Hmm.
man, I want to empower the dentists to be the ones to get the great outcomes, to have
Hmm.
predictable, financial outcomes. But beyond that, like be in great partnerships where everybody's aligned and everybody is incentivized to not just grow, but to grow the right way. Make it about the teams, make it about the patients. And you know what? When you make it about the teams, make it about the patients, and make
Hmm.
sure that everybody is in a winning situation, well, that's an unstoppable movement. And that's where things are going. And I'm excited to be a part of that moving forward.
Absolutely. I feel like, the pandemic, we fell on our face, right? A lot of us, we fell on our faces, but sometimes you have to fall on your face to see things from a different perspective. Sometimes that needs to happen for your paradigm to shift and for you to realize, oh my gosh, I could do things so differently. And that's where the landscape is going, and that's where this revolution among dentistry is happening. Is dentists are realizing, oh my gosh, I need to think differently, and we need to structure things in a way that help benefit us more than anyone else in terms of the corporate entities.
That's right. I mean, absolutely. And because it is kind of relatively new, moving in this direction, I mean, it's
Yeah,
very clear. The pathway for me is extremely clear.
right,
But like saying all this doesn't necessarily mean a lot to a
right.
doc who is like, what the heck are they talking about? And that's why I'm loving the conversations that I've been having. It's just, again, it's like when everybody else is saying the sky is blue and I'm looking at it like, no, it's red now. It's red because it's just it's just a different world. It's a different way of looking at things, and it's a way that, like you said, it's a revolution. I mean, it really is, and the revolution should be on in the favor of the dentists, the entrepreneurs, the ones who go out there and create value for patients every day. And that's exactly what I am doing right now, and I'm super excited about it.
We'll make sure that our listeners are given the opportunity to reach out to you and be in touch,
Sure.
as you continue to, develop and grow this vision that you've talked to us about. And as you give opportunities, as opportunities arise to work with you in whatever, projects you work on to allow dentists this kind of control and power.
Thank
It's,
you.
it's super exciting. We'll make sure to get your information here at the end, but we got some more
Sounds good. I
questions for you.
appreciate that.
Yeah. Go for it, Carter.
So, tell us a little more about luxury dental retreats. What inspired the concept, and how do you see it benefiting dentists?
It's funny, Carter. It's become a passion project, and it's
Yep.
a relatively new concept for me. Even over the summer, I was talking with a buddy just about like what would I really enjoy and where my skill set or expertise lies, in terms of creating value for dentists out there.
Hmm.
And it was funny. He just asked some good questions that led to some clarity and revelations. And man, back in the day, I used to do 300 or 400 hours of continuing education every year. Like no joke, it was
Oh
Whoa,
my
insanity. We were
gosh.
that's
spending
crazy.
150, $200,000 a year, taking
Oh
my
my
team all over the
gosh.
country. I was doing something like every other weekend. It was crazy.
Oh my
And
gosh.
then, as an educator, I was traveling almost every other weekend for several years, and I was able to share so much just from my insight, experience, knowledge, relationships with other doctors, while continuing to learn from them. Because we all learn more from teaching almost than we do from being students. But at the end of the day, I love dental continuing education. I love personal growth and development. I love merging those two. Whether I'm an educator or a student, I'm always learning something from those situations. But with all of those thousands of hours of CE that I did over the years, my best experiences were always in small groups.
Hmm.
I mean, there were so many times where I was like one of 1,000 or one of 100 or one of 75, whatever, in these big groups. And I could learn, it was great, but they're distractions. It's typically in a venue where, I'm in some hotel ballroom or some
Right.
convention center, very sterile. You get your buffet food and it's like, yeah, it's take it or leave it, whatever. You don't get much access to like the speakers themselves, like sit down and have a real conversation.
Right.
Um, I mean, I tried to make my own opportunities and like basically just be bold and like strike up conversations after hours and all that sort of thing. But it's not as easy to do in a big format. And so I thought, man, how can I create unique very small group opportunities for dentists to learn and grow as dentists and as humans, and to have access to like some of the best educators in our entire industry. You know, I mean, like we're talking about me and oh, hey, Jim knows all this stuff. He's done all this stuff. Great. But I'm not necessarily the world expert in dental implants. I'm not necessarily the world expert in terms of, you know, great cosmetic dentistry, although I taught it for a long time. I'm not the world's expert on going fee for service or, you know, maximizing specific systems within your practice. I've got knowledge and experience with all of those things, but man, I have friends who are the best in each of those niches. And so rather than me spend 100 hours creating content for every single event that I'm going to put on, why not bring the best of the best along with 8 to 10 really growth oriented, like-minded professionals where we can learn and grow in that small group setting with the very best people.
Right.
But sorry, I'll talk for just another minute.
No. This is incredible. We love it.
It's crazy too because I love travel. I've been doing luxury travel with my family for 25 years. And I'll admit, I became kind of a travel snob. Like, I like things to be very nice. I like to feel special. I like to feel catered to. And I know a lot of dentists feel that way. You know, they want the Ritz-Carlton Four Seasons service. You know, they want the freaking gourmet meals. They want amazing experiences. And so luxury dental retreats is exactly what it sounds like. I'm taking 8 to 10 dentists every month to some amazing destination in a rock star venue where they get access to the best education they could find in whatever niche they're interested in a conversational, very casual setting. They can ask us questions in real time like this.
Yes.
And sort of troubleshoot things, apply things to their specific situation. And guess what? Every attendee comes with a different perspective and different experience. And they bring a lot to the table, which is hard to share if you have 100 or 200 people. But with 8 to 10, everybody gets involved in that conversation and everybody can elevate to a totally new level. And guess what? At the end, middle of the afternoon, when we've done 5 or 6 hours of education like that, we're going to be on a yacht. You know, we're going to be out there, you know, in the sun, continuing these great conversations, building deep relationships. We get back to the villa. We've got a chef who's going to be preparing all of our meals, which will be hand selected by me. We'll have opportunities to, you know, get massages at the villa. I mean, when I say fully staffed, it means concierge, chefs, massage therapists, like just real luxury, like no skimping on anything. And so
no, you mean it. That
sounds like fun, doesn't it?
It does. I want to go.
And you know, when you can learn all this stuff and leave with like a real action plan to implement everything they learn afterwards, I mean, it's not just a great experience, it's not just great education, but there's huge ROI. And the ROI is in terms of financial success, but also in relationship success. Like they got me as a friend moving forward. They have our speaker as a friend and resource moving forward. And you just don't get that kind of opportunity in too many other situations.
What's really cool is that your confidence to deliver that ROI is sky high. And the reason why I know that is because of how luxurious this retreat is, right? Your confidence to deliver these dentists an ROI from their experience there is incredible. Your passion for, educating dentists, empowering dentists, and bringing them together is incredible. And I feel like
Thank you.
I also can see that you're passionate about helping dentists find good balance in their lives and bringing that camaraderie into people's lives that also promotes mental health. And being able to lean on each other and have those great experiences in those intimate settings, I can tell is really spectacular.
Cassie, you just said something I think is really important. When I started dental school 32 years ago, they told us
I didn't say it.
I know, longer than you've been alive. I get it.
Hey, but just barely.
What you're saying is I'm old. I get it. I'm old. But
you're not.
Wisdom comes with age. perspective comes with age.
Hmm.
But no, 32 years ago, they told me on the first day of dental school, dentists have the highest substance abuse, highest divorce rate, and highest suicide rate of any profession. That was
Hmm.
32 years ago.
Hmm.
Recently, somebody told me that dentists are still in the top 3 in all of
Hmm.
those categories. And that is a tragedy. It
Tragedy.
is unbelievable and unfathomable, and it should not be a thing.
Right.
And every one of these retreats, it's got a component of it will be mental health, will be personal growth, will be not only becoming the best versions of ourselves we can be, but having that support network
Hmm.
and the realization and knowledge that, man, other people are dealing with the same challenges that you are. And
Right.
if you have those kinds of challenges, there's nothing better than being in a small group where what is said here stays here. And
Yeah.
we can help support one another, not only from a business standpoint, while that's super important, the personal side of things is every bit as important.
Absolutely.
So,
I
in fact,
agree.
in February, we're doing a retreat that is really based upon
Hmm.
personal growth, body, mind, and spirit. I mean,
Yeah.
that's where it all begins. And if you don't have those things sort of squared away, then it's going to have a negative impact on your relationships. It's going to have a negative impact on your business. And so
True.
let's get those things squared away so that every element of our life has the opportunity and potential to really explode in a positive way in a
And I
supportive
love how
group.
passionate you are about it. And I know that you are on like a 120 something day streak of you know, working out, of meditation, of whatever that looks like. How's that been?
Well, I believe today was 135 days, just to
Oh my
correct you.
gosh.
Wow.
Congrats.
Honestly, it's been great, Cassidy. I mean, full disclosure, I was an All-American runner back in high school as a Division I athlete, and so like
Yeah.
exercise is not something new to me. But when you talk about like building your career, and I've got 4 kids, and I've got a
Hmm.
beautiful, amazing wife, and I've had a very full life over the last 28 years since I graduated from dental school.
I love that.
And along with that, the balance piece is sometimes difficult. And, when you let your physical health get away from you a little bit, guess what? It affects and impacts every other area of your life. And I
Hmm.
have had seasons where I have not been as diligent. I have not been as dedicated and disciplined to do the things that I need to do. And so, to your point, over the last 135 days, I have set out on a whole new course. I'm 55 years old. I actually started this the day after my 55th birthday because
Wow.
I just saw myself like not being as vivacious as I had been just a few years earlier. I wasn't as physically fit. I wasn't as kind of emotionally fit. I wasn't as spiritually connected. And
Hmm.
it was having an impact on, some of my relationships. And so, you know what? I made a commitment. And now every single morning I start with a routine that is get up at 5 in the morning. I spend a half hour with my wife, and I got 2.5 hours dedicated to me, making sure
That's
that I'm making
incredible.
progress in all the most important categories of my life. And I can still then be sitting at this desk and working by 8 a.m. and have a killer day where I've already accomplished a ton before I even started working. So,
It's true.
yeah, I'm excited about sharing that with Dennis. I mean, man, talk about
Yes.
something that can move the needle quickly. It's
Oh
moved the needle
yeah.
fast for me, that's for sure.
That'll move the needle and help drop the drop the dental profession below the top 3 for those mental health problems for sure.
Yeah.
It's a passion of mine, and I'm committed to spending the next 20 plus years doing what I can to help change those factors
Thank
for
you, Jim.
Dennis.
Thank you
Awesome.
so much.
Well, I know you mentor a lot of dentists into business success. And just out of curiosity, what are a few things you have mentored dentists to achieve in the last 10 years?
Huh. Uh, Gosh, I mean, there have been a million different things. If I were, if I were to like just sort of simplify it, I'll say kind of the broad categories that I think have been most helpful, most beneficial, and where I think I've been able to help dentists move the needle the most is, I mean, number one, I mean, certainly clinically. I mean, at the end of the day, we got to take really good care of our patients. And anything that I've ever been able to do as a clinical mentor back in the day with the David Hornbrook group or a variety of other groups, or as the fellowship chairman for the Academy of Comprehensive Aesthetics, helping dentists like elevate their cases to a level where any one of us would send a family member to them.
Right.
So the clinical stuff, I mean, I love that. And I've enjoyed helping dentists just become better dentists. But then the next level, and just as importantly, I think, is on the communication side. Like, look, there's so many really talented dentists out there, dentists who have great hands, they've gotten learned great skills, but if they don't have the communication skills, if they're not able to sit down and have comfortable conversations with patients, look them in the eye, and, whether it's about like what they're going to do for them and help them feel comfortable with that, or whether it's about talking about money and feeling comfortable saying, yes, it's going to be $60,000. And without quivering or without looking away and that sort of thing. The communication piece is so important, because you have the greatest clinical skills in the world. If you're not able to effectively communicate that to patients, you're not going to do much dentistry. Leadership is critically important. And as well as I do, Cassidy, in dental school, you don't learn much about business. You don't learn much about communication. You don't learn much about leadership. And I know that's changing slowly in a lot of schools, and some are better than others, I'm sure. But I can tell you, 28, 30 years ago, we didn't learn anything about anything. And so it became a lot of trial and error. It became a lot of getting great mentors who were doing that well. But when you can provide dentists with some of those skills, or at least elevate them to whatever capacity they have, oh my God, they can double their practice within a couple of years just by taking on some of those new skill sets.
Yes.
And confidence, becoming confident that they already know they can do it clinically, but knowing they can have conversations with confidence. And part of becoming better leaders means that they are leading their teams more effectively. They are helping train their teams to have some of these conversations for them. Because you know what, no matter how much you can train somebody to do a certain thing, if it's not really at the end of the day within their comfort zone, well, they better have somebody on their team for whom that is comfortable. And so sometimes recognizing who on your team is best suited to take care of A, B, C, whatever the task is, that leadership component becomes critically important. So
I agree.
All of those general skills, I mean, there are a lot of soft skills, and I think a lot of times, especially corporate dentistry, they undervalue the soft skills. They're just like, go produce, without actually giving them the skill sets they need to be productive, or scheduling things in a way that they can be productive, or giving them the team that allows them to be productive.
Right.
But when you add those components, I mean, I've seen doctors double their practice, triple their practice, add additional practices, get into situations where they can do all of that while taking on much lower risk than they thought they would have to do. And those are the things that I love, helping them do. Again, it's not just from my successes, and I've had a lot of them, but it's from my many, many failures too. It's like, do the things I did to fast track your career and avoid the things I did poorly, so that you don't have these roadblocks that I had at various points along the way.
That's the beauty of mentorship, Dr. Jim, is so that we can learn from people's mistakes. I mean, that's what I've taken, from all of the mentors that I've had so far is, I've got a fast track to success thanks to the mistakes that others have made and their willingness to share their experiences and with me. It's so valuable.
It's funny. It's a timely discussion. Just yesterday, I was on the beaches of Puerto Vallarta with a dental
Puerto
retreat.
Vallarta.
I was with an amazing group of guys, and there was a lot of just really deep shares. I mean, like stuff that you're not necessarily comfortable talking to 100 people about, but in a small group we're able to share a lot and really grow a lot individually. I mean, we were talking about our marriages and what our challenges were, and it was amazing that, oh my God, we had the same things going on, the same kinds of challenges, and he maybe had some insight that was going to help me, and vice versa. But I bring that up because yesterday morning I went for a 4-mile run, and then I had my phone camera on. And I was talking to the camera about authenticity. I was talking about relatability, and I was talking about how that gives you credibility as well, anyone in life. I mean, I'm talking about like dental education specifically, but think about the people you know in this world. Um, I've known a lot who basically, they want you to think that they've never made a mistake. They want you to think that everything is perfect. They want you to think
Right.
that they've got it all figured out. And what I've learned over the years is nobody's got it all figured out. We've all
Right.
got similar challenges. We're all different, but we're all similar in more ways than we're different. And so my social media post yesterday, it was a video I took walking on the beach. Well, by the way, right in the middle of it, I slammed my foot into a big rock, my bare foot.
Oh.
Like,
Is that what happened?
I stumbled along. Hey, it doesn't get any more real than that, man. Like, you're not gonna get a perfect video from me. You're gonna get like the real deal. And I said, over the years, I've always gravitated towards visionary leaders, people who have different ideas. They think outside the box, but they have the credibility and the relatability to make it seem possible. But relatability and credibility and vulnerability a lot of times does come down to just admitting your faults, admitting your mistakes, and that transparency is what I think allows a lot of people to grow. And that was my whole post yesterday, and I felt good about it. I felt vulnerable because I admitted stuff that I didn't necessarily want to admit, but
Sure.
I realized now that if I can't be in a room with somebody, the next best thing is to talk to them on video. And so I've been getting out of my comfort zone lately and trying to do a little bit more of
You're
that.
continuing to inspire so many people. I follow you on social media, and you've been great. I love all of the great traveling and all the relationships you're forming and all the inspirational messages that you're sharing, and I just really want to thank you, Jim, for coming on here with us today. I think we're going to wrap up, but I want to ask you, what would be a great way for people to reach out to you who are maybe interested in the luxury dental retreats, or interested in just mentorship or partnership opportunities that are coming up with you in different projects you have coming up, where dentists can be majority owners in the groups? What would be a great way to reach out to you for those kinds of opportunities?
Oh, yeah, thanks. I'm happy to talk to anybody who has an interest in any of those areas and provide value where I can. But they're welcome to call or text me at 219-241-4698. Usually easier to text me just because we're all busy and it's not always easy to pick up the phone. But if someone shoots me a text, then we can schedule a call where it's just a little easier to communicate in a relaxed manner. Or they can email me at drarnold@smilesbyarnold.com. Like Dr. Arnold at smilesbyarnold.com. And I'm usually pretty good about checking email and getting back to people. So happy to help if I
Thank
can.
you.
Great.
Thank you.
Well, it was great having you on today, Dr. Jim. Maybe we can get you on in the future to talk more about your journey. That would be great. Thanks for tuning into the Revolution Dentistry podcast. If you're finding value here, make sure to hit subscribe so you never miss an episode. We're here every week to help you grow. See you next time.
All right,
Thanks,
thank you,
guys.
Jim.